You're listening to the Queer See Me podcast, where radical body autonomy meets clinical expertise. I'm Dr. Crystal Beal, founder of QueerDoc and your host. Join me and my phenomenal network of experts as we explore the nuance, joy, and liberation possible in gender-affirming care. Let's learn, unlearn, and do better together.
Well, everyone, welcome to Queer CME's podcast. I'm super excited today to host someone who apparently we've known of each other since like 2012. Yeah, amazing. Okay, well, I would love to have you introduce yourself, and then I'll start asking you many prying questions about all the things you do.
All right, my name is Briar Brodwell, and I'm a licensed dispensing optician in Washington State. That means that I'm not the doctor. I'm like the pharmacist of the eye doctor. So the eye doctor writes you a prescription, and then you come and you see me, and my specialty is lenses. So lenses for glasses and contact lenses, as well as in my spectrum of care. And then it's up to me to interpret the prescription to get people the cosmetically most beautiful results, but also obviously the crispest vision possible. And sometimes that is a combination of seeing their prescription and seeing the shapes they like. It's a really interesting thing. I have to also deal with things like the US healthcare system and insurance and all that. Have a unique job that I love that almost nobody knows exists at this point. So it's really weird to kind of describe what I do to folks all day.
I feel like the analogy, like I'm the pharmacist, was really useful and helpful. Thank you for that analogy. Before we dive more into like your work, I would love you to share whatever you feel comfortable sharing about your identity at Queer CME. I do try to lift up voices with lived experience, right, as well as career or professional experience. And so whatever you feel comfortable sharing about your identity and your pronouns, we'd love to start there.
Yeah. So I am a 41-year-old trans man. I'm an expat from Queens in New York City, and I have lived in Seattle for the past 13 years. Very integral to my identity, I am a pug owner, parent, whatever you want to call it. I have a 12-year-old pug named Morty, and he's the light of my life. And my friends sometimes joke that I have like the queer EGOT because of how many times I've like come out. I'm a full believer that I'm still not in my final form, possibly. And my goals include being like a crotchety old woman. I would love to be a crotchety old woman, like a Sophia from the Golden Girls. That would be nice. But who knows where my gender will take me, you know? But I've been socially transitioning since 2017. And then since 2012. I don't know why I said 2017, since 2012. And then I've been hormonally and surgically transitioning since 2015. So it's been a whole 10 years. That's kind of nuts to me.
Yeah, wild. Yeah, I feel like I say really commonly, both when I'm working with patients and when I'm training and teaching, educating, that for some people, gender is the destination, and for some people, it's a lifelong journey. So I love your plan for the continued evolution.
Right now, my identity has recently shifted. I was using they, them pronouns and very squarely identifying as non-binary up until last year, when I had a moment and I realized that whatever's currently going on, right now I feel like I'm a binary trans dude, which is really new to me. So I'm using the he, him pronouns.
I love
Seeing how that feels for a minute. We might stay, we might go.
This brings up so many things to me that aren't like specific to what your work. So if
no problem.
Stray, feel free to bring us back on subject. Also, I should let you and the audience know I probably have autism or complex trauma. I'm not sure. But I'm using so much of my capacity to like be okay with the current political situation that I find that I have much less capacity for masking. And my hyperverbal processing has become quite a bit more prominent and noticeable. So we'll be on that journey together today.
Was that medical talk for I talk too much right now?
Yeah.
Okay.
Good.
I
Exactly.
don't have an official diagnosis, but my psychiatrist and I proceed as though I have autism at all times, basically.
Right.
And when you told me you had autism, it made you make a ton of sense to me, a person also with autism.
Yeah. It's like, oh, okay. It's really funny because when I talk about it with people who have autism or probably have autism, they're like, oh yeah, okay. But when I talk about it with people who don't, they're like, I don't think you have autism.
It's because they only see this. They don't see, I deal with this when I advocate for myself at all times. I'm like, you don't get to see when I'm at home. And I literally I'm able to go home, walk the dog, feed myself, and I pass out because I cannot function. And then the house is a mess. You get to see this. You get to see this Dr. Beal and this Briar.
Yeah. Absolutely. But yeah, no, so you brought up so many things and saying like about gender continuing to evolve and like I think, and also about pronouns, it made me think one of the things I was really thinking about, I just read the book Boy Slut by Zachary Zane, which if you haven't read it, I think it's really fun. It's his like memoir and manifesto. And he's a cis man and he's bisexual. And he talks a lot about how, so many people use the identity of bisexual as a stepping stone to like figuring out that they're gay or homosexual, and how and I feel like he doesn't see that there's anything wrong with that like everyone's identity evolution is like their story and that's fine. But he does talk about how that being such a common thread has kind of maybe harmed the identity of bisexual because like everyone everyone in the queer community is like, oh, you're not really bisexual, you're going to be gay in like a few more years, right? Like, and he's like, no, I've been bisexual my whole life and I think I'm going to continue to be bisexual. And so, and not that there's like, right, like I don't think a continued evolution of gender off of non-binary into something else, like there's nothing wrong with that, right? There's like that is so many people's journey and story. And for some people, I think non-binary was a stepping stone and maybe is something that was helping them get where they were headed. And I think for other people, non-binary was their identity. That is their identity at that time. And it wasn't that identity continuing to evolve doesn't degrade their non-binariness in any way, I guess is what that all makes sense when I said it.
Yeah, I was based, was really profound to me, and I discovered this all on my own. This was not a me going to therapy situation. A lot of my identity was based on how I did not fit in or relate to men, okay? And not how much I actually did relate to men, And it took seeing and being in community with excellent cisgender men to realize that I was a man.
Yeah.
Good men with good hearts. They just like accept me. They don't bully me. It's a big deal. Men bully each other all day long.
Yeah.
That's a thing. Like pecking like little chickens all day long. And they don't do that to me. And only then when I met good binary men was I able to be like, oh, actually, I think this is me.
Yeah.
And it's felt good so far.
Amazing. I feel like maybe I should hang out with these men you're hanging out with because my listeners are going to be like, God, Crystal. I'm like, I don't know that I really know any cis men that I think of as good.
Crystal, are you ready? These are the men from my synagogue.
Of course, I have a type. I always have a type. For any of our listeners, like almost everyone in my life is Jewish. So yeah.
we love a powerful femme.
Yeah. Right.
We're probably like attracted to like flies to a light or like.
It's so true. It's so fun, but amazing. I think also the thing you mentioned about like these are my pronouns now, and these are representative of my transition and my identity. I was filling out like a clinic somehow, like I was going to be a patient somewhere, and they had me fill out something, and it was like, what is your gender? And then the options were all pronouns, and I was like, oh, someone didn't pass their gender training.
when I showed up, we put pronouns on the form, right? I was like, oh, we got to get pronouns on the form. And then it was, I can't remember, it was before lockdown. So this must have been 2019, my first year there. A man, just like a very, like an older cisgender man was sitting in the office, and this offended him that we were asking for pronouns.
Yeah.
So sometimes when men get nervous, they get very loud to like cover up their nervousness. And I think he just felt uncomfortable and scared. So he stands up and he's like, oh, pronouns, you say, blah, 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 blah. And then we all just looked at him, and then he was like, do I have to fill this out? And we all were like, yeah, you do. You do. And everybody just simultaneously allied, and we just gave him the stankest eye. And he just filled out his form. He just put his hand. Go ahead.
Yeah. Yeah, you got this. It's not that hard.
Sure.
Yeah. You know, I train and teach a lot around the country, and it's so interesting. You know, wow, we're going to derail a lot today.
We are. Sorry.
It's great, though. It'll be fun. I was talking with one of my partners yesterday, and they were really talking about how fascinating someone they were talking to had like moved to Detroit, and was talking about the difference in like anti-oppressive frameworks in Seattle versus Detroit, and how in Seattle a lot of us use like quote unquote the more current or recent language, like the most woke language. I air quoted that for anyone who's just listening. And how in Detroit maybe people are using language that's less affirming, but are taking actions that are more congruent with an anti-oppressive framework. And how in Seattle, we maybe won't take the actions, we'll just use the language. Like, that's interesting.
It's true.
Yeah. Yeah, really fascinating. And it was good because I got asked in one of my trainings the other day, like, how would I talk to people about a gender thing who like really don't have like an initial framework, you know? And I didn't have a great answer to the question that they were asking, but I was like, you know, I train and teach in the South a lot, and people are like, patients can get upset sometimes when you ask them like their chosen name or what they want to be called. And I was like, you know, I grew up in the South, and my grandfather is Arthur Chipman Beale Sr. My dad is Arthur Chipman Beale Jr. and my brother is Arthur Chipman Beale III. And none of them go by Arthur. My grandfather was Art, my dad was Chip, and my brother's Chipper. So it's like, this isn't just for trans people, right? This actually,
correct. We use preferred names all day.
Yeah. This is just for everyone.
The Pope changed his name just now. We were all like, okay, Pope Leo, great, and we changed.
Yeah, just for everyone. Okay, amazing. We derailed some, and then we'll circle back to, okay, so you are like the pharmacist of the vision world. Love this analogy. Yeah, really great analogy, I think, for everyone, but also our listeners are primarily prescribing clinicians, and so, you know, a really good analogy for them as well. So yeah, and when, like, FYI for all of our listeners, Briar works at one of the optometrist and optician places I go regularly. And the glasses I am wearing right now, y'all did for me. Yes.
Thank you.
We love. I am a model for your workplace today. Also, the sunglasses I'm wearing on the like image that's going with this, y'all got me. They're Jack Durant.
Yeah.
I feel like a movie star whenever I wear those sunglasses, like, for sure. But yeah, maybe talk more about, I guess, like what I'm saying, like, I love those sunglasses. I love those sunglasses so much. I lost them, and I actually came back to y'all to get me another pair.
You rebought them?
Yes, I rebought them because the way I feel in them is so powerful. You know, and so maybe can you tell me more about helping people find that feeling? Like, yeah.
In terms of wearing a pair of glasses, beyond getting someone seeing better than they ever have in their life, that's always incredibly fulfilling. The act of this being, frankly, your main accessory, this is square in the middle of your face. Like, you got you got two earrings on right now, but what I'm paying attention to is the glasses in the middle of your face, right? And because of that, we deal here with everybody's tiny insecurity about every part of their face. And it's part of my job, honestly, to make people get even like a tiny spark of confidence in themselves sometimes, and just like see themselves more objectively. And I tell everybody this, like, I believe every single face, nose, eyebrow, lip, is beautiful.
Yeah.
That's it. Whether it's how you were born or you chose a new one, I don't care. It's beautiful. It's supposed to be just like it is on your face. And I tell them it's not, a lot of people be like, I've never found a pair of glasses that I like. And I was like, that's because you are looking at glasses that are probably designed for somebody else's face and somebody else's nose. And I have things that are going to fit you and feel amazing, no matter how wee or giant your head is, no matter how high or low your bridge is, I have. And they really appreciate eventually. They're usually nervous because people don't get service like this anymore.
Yeah.
But they see, like I try to describe it as like, I don't want to dog lens crafters. If you got to see a lens crafters, go see a lens crafters. But lens crafters is like being at the Honda dealership and they're trying to upsell you, upsell you, upsell you. And then where I work at II, that is not our focus. And it's more about me being the Sherpa, giving everybody access to the bazillion glasses we have here. We truly have a ton, several thousand pairs of glasses here. And the vibe is better, much better here in terms of just like all that.
I'm like, we can talk about how much more individualized care is in small businesses than it is in large systems. And the same thing, right? Like I won't take us down this path for too long, but right, like I always tell people, I don't see like Planned Parenthood or Plume or Folks Health as competitors to my practice. Like one, that's such a capitalistic mindset, right? And I'm really like don't think capitalism is useful in healthcare, right? Two, those things give trans people options and choices, and I want trans people to have options and choices, right? And three, like those places do, because they scale so much, they do expand access in a way that like I, as a small business owner and a private practice owner, never could do. Like it's not within my capacity. It's not within my skill set. It's not within my finances. It's not within my passion or goals or desire, because like what I love is that individualized, like relational experience, right? Like I want to know you. I want to know what you want and need. I want to know your fears. I want to know your dreams, right? And then I want to help you achieve them with like an approach that's really unique to you. And
just
that
for you.
Right. And that is something we can do on a small scale. We can do that in a one-on-one setting. We can't do that at Lens Crafter or at Folks Health necessarily. And that doesn't make those places bad, because like choices are good and everyone needs access. But it does mean that the experience you get when you come to me at QueerDoc or come to y'all at II is very, very different.
Very, yes.
Yeah.
Very. And I understand specifically why people are hesitant to receive service in a medical setting too. No, like absolutely. Like I just know every category of otherness has been abused in some setting, medically. And when you get a friendly person who's honest and just literally trying to help you, it can feel jarring.
Yeah. Right. For sure. Yeah. Okay, I'm gonna bring us slightly back. Not that we really got off topic, but I really want to talk about, because when we were interacting at your lovely place of business at II, we were talking about how you are very often a place people come to get their first like affirming pair of glasses. And so I really want to talk about how, as an optician, your work like marries with gender affirming care.
Beautiful. So first off, when you come here, you're coming to a place that's going to respect you. Just whatever you say, this is my name, this is my gender. There's no questioning. It's just like, no one's going to be like, oh, that's novel or anything like that. It's just like, is who you are, and that's it. Frankly, the toughest part of my job at that point is just being like, sometimes you might know this. Are you credentialed with insurance? I have no idea.
I know. I used to work in insurance-based systems, but I don't use insurance anymore. No.
When I do take insurance, I have to, this is my trans way of asking the question. I go, hey, I really don't care what gender's on your ID, but I need to know that gender so that I can get paid by your insurance.
Yes.
What is it? And then I'm literally going to forget it. So what is that? And I'm going to forget it. But it started slowly. People realizing that I was trans and that I worked here and that I did this. And now it's pretty frequent. I'd say at least maybe 2-3 times a week even, where I see other trans people, thank you, and they are looking, they don't know they're looking for an affirming pair of glasses, but they're looking for an affirming pair of glasses. I always joke, and this is like a real phenomenon, that like, I don't know why, but like small mass people and large femme people will always wear, for infinity, if I don't intervene, a tiny like silly cat eye for the mass person, and then a giant like rectangular metal frame for the femme person. And then as soon as I swap those two ideas, right, they're like, whoa, this is me. They just never even imagined that could do that for, like, it's that powerful.
Yeah.
I have like a very close friend who is a very tall trans woman. So in terms of passing, whatever that is, it's not a thing, right? So right. It's not a thing.
Yeah.
It's just like, there's always going to be stuff.
I'm going to interrupt you for just a second. Yeah. We have a lot of listeners who are allies, right? Who don't live in the community. And so what Briar is saying, right? Clinicians, you will sometimes hear patients talk about passing, or like if you ask them what their goals for care are, they'll say passing. And then in culture and in society where we really, how can I say this well? Where we like really talk a lot about the evolution of gender and gender theory and things, like we'll often say, passing isn't a goal, or we don't owe anyone passing. We don't owe cis society passing. And passing is so intrinsically tied to white supremacist ideal standards of beauty, right? And while all of that is true, passing is also very closely associated with safety, right? So the ability to move through society without people perceiving your transness or noticing your transness is very closely linked to also safety moving through society. And so,
thank you.
Right. Well, like, yes, here you and I will definitely say like, fuck passing.
Some people don't have an option.
There's also this place where it's very, very important. And I think just having the complex understanding of all of these systems and how nuanced it is like really essential. And so, I feel like and I would say for allied clinicians, this is a conversation that even as a trans person who like lives and breathes this every day, I still sometimes get a little nervous having, right?
Yes.
So like as allied clinicians, it's okay. But yes, like back to your friend who's too tall for people to not notice.
She was wearing the big square pair still, and I was like, homie, let's get you the biggest, fattest cat eye I could find.
Yes.
So we do it. And it's because until she was wearing this in the middle of her face, people could find all these ways to ignore who she actually was. They would often not look at her face. They would look at her feet. They would like just act like she was there, but she wasn't there. And they would misgender her. And once you got that on your face, if somebody misgenders you in that femme of a situation, it's them. Something's wrong with them. Like it's very clear that this is not a dude. Like, please don't dude me, you know? And all glasses are gender free. I don't want anybody to think that glasses have a gender. And in fact, cis men, if you watch a current rap music video, you're going to see cis men in a cat. So like, yes, every day, all day. But I think it's still read as femme. Even if cis men are wearing it, I think it's still read as like a little radical and a little femme at this point. So it's interesting because I don't want to gender it, but also it's very gendered.
Right. I love your, like, it's like I planted you in the audience. Like you're referencing things I teach all of the time when I'm working with clinicians, right? And so because the clinicians, one of the requests I get all the time is like, can you do a lecture on non-binary treatment options? And I go, yeah, so gender is an internal sense of who we are. So treatment options don't have that. So there's no such thing as non-binary treatment options. There are treatment options that help people achieve different goals in their gender care. And so I can talk about those. I actually call that lecture out of the box care options a lot of the times, because I actually do a lot of things that aren't in the guidelines or in the protocols, a little out of the box. But yeah, I think absolutely glasses do not have a gender. They do not have an internal sense of who they are. We in society, exactly as you said, have assigned a gender to them. Like we've said, this
so weird.
This.
It's so weird. Like the more I think about it, the weirder it sounds in my head, doesn't it? Just like, I don't know, it's like it bounces off the walls of my head and feels more ridiculous each time it bounces off.
Yeah, but I just like, it almost made me cry when you were saying like 2 to 3 times a week someone comes to you to buy their Affirming glasses. I just feel like I spend like all my work day helping people be who they are. And like facial dysphoria can be so significant and so
intense. Yeah.
It can really, if like we're uncomfortable with our face, we really restrict our interactions with other humans. Like it really impacts our life and our ability to like have and maintain relationships, to have and maintain jobs, right? To like take care of our own health, like to go see a doctor. If like every time like my face has to be out in the world, I am feeling this deep sense of dysphoria and distress, like it really impacts that. And so having this like, and hormones do change people's faces, to some degree over time. That's a gradual process and takes years. And obviously there's procedures and surgeries people sometimes pursue as well, but those are much harder for a lot of people to access because of like surgeons who do them, finances, costs, all of these things, and coverage. But like glasses, like that is something that's like in the spectrum of accessible, like versus
much more.
surgery, so much more accessible.
Yeah.
To have this that could really just like significantly impact someone's facial dysphoria, like
instantly.
That is so cool.
It's so nice.
Yeah.
And there's times too when this is usually a trans feminine person who's like, maybe they've just come out to themselves, right?
Mm-hmm.
And she's in front of me and she's choosing between two things, and one option has glitter, usually at this point. And then I'm like, listen, you can go with these other things, they look perfectly fine. But I feel like if you get this glitter pair, you're gonna really like how you look. And then you're like, and it's like a weird like life-changing moment, because you don't consider that happening at the eye doctor.
Yeah.
The eye doctor is like not really a magical place necessarily, but this is magical stuff that happens.
I mean, it kind of is magical though, because I remember being in like 7th grade when I got my first pair of glasses, and it was like, that like, oh, trees have leaves, like they're not just green blobs. It's magic.
We don't do a lot of pediatric care here, but when we do, that is the part of it that's incredibly fulfilling to me, particularly not when a child isn't able to see in the distance. When they're not able to see up close, they often have a really strong prescription. So anything kind of high 5 distance or closer is extremely blurry to them. They put on their glasses and they get to see their own face, their mother's face for the first time.
Yeah.
That's nuts to me. That's insane. And adults too often get their first ever pair of glasses, and then we're going outside. I'm like, okay, just like you did. I'm like, okay, now lift them up. Now put them back. Now lift them up.
It's so delightful. And it's so
nice.
Fun. And I think so it is magic. And I think you kind of bringing up the point that like going to the eye doctor doesn't feel like this place or this opportunity to affirm someone's gender or this place where magic happens. And I think that is such a beautiful moment to like say, like, actually gender affirming experiences happen in every aspect of healthcare, in every part of healthcare system, but also in every part of our life, right? Like gender and who we are is a facet of everything that we do and of every experience and encounter we have. And so, really, when we think about gender affirming practices, like, my goal, like, by the time I like leave this world is that, gender affirming care is taught, and there's a word for this that's left my brain, but that's okay, in an integrated fashion throughout medical training and education. So there's not like the gender course or like the gender lecture.
It's not an add-on.
Yeah. Yeah. It's not a 1 hour PBS special. Right. Like it is actually just throughout the curriculum. Right. Because it is throughout our lives. And it's throughout every aspect of healthcare. But I think sometimes I talked to ear, nose, and throat doctor one time on a podcast, and we were talking about consent-driven care, which is not a term, it's a term I coined, so it's not something you can look up later. But I think you actually demonstrated it incredibly well. It's like a aspect of trauma-informed care, right? That like just getting consent before each thing. And you fitted me for classes the other day, and like before you did anything, you asked if you could do it, right? Like you checked in every step of the way about the process. And it wasn't like you asked the first time and then you just were off and running. You did it like
every time.
Yeah, doctors can learn a lot from you. And so yeah, and he was like, well, there's like implied consent. Like when patients come to see me for nosebleeds, they know I'm going to do a nasal speculum exam. And it's not really like a sensitive subject. So like, I don't really need to like check in with them about all of this. I was like, first of all, this general population has no idea what the fuck a nasal speculum is. Like
all I heard just was you're going up my nose with what? Like just
right? I mean, no one knows what that is. Second of all, nosebleeds can be a very sensitive subject because they can be driven by intranasal drug use. Right? Like this actually.
Thank you.
Right? This actually could be some like, and it was so funny because like he just thought like, oh, there's no reason for me to be sensitive or thoughtful or considerate or, and I was like, everything we do should like Ray as healthcare providers, because this is someone's life and body. And like, particularly for, honestly, like most of the world, like, right. If you are not like, if you are Black or brown, if you are fat, if you're disabled, if you are femme, if you're a cis woman, if you're trans, if you're homosexual, like we don't have autonomy over our bodies in both in the world, but in healthcare spaces, like you're referencing, like our bodies have been used and abused for like medical research and experimentation. And so it's so important that we hold that history, like within us as clinicians and providers when we're working with people. And you demonstrated that so well when you fit me for glasses. I feel
Can I interrupt?
Yes, that's great, because I lost the thread, so you take it away.
I'm just interrupting because most people don't know what I do. So when we're talking about me touching Dr. Beal, it is because I can call you Crystal. Okay.
Yeah.
When we're talking about me touching Crystal, to my job, one aspect of it is adjusting the glasses when you pick them up. Your glasses can be adjusted by an optician. They're supposed to be fit to you like a tailored pants almost. So in order to do that, I have to check behind people's ears a bazillion times during this process. And anytime I'm going to touch somebody's face or their hair, I ask specifically if folks are, here's other things that happen. If someone comes in wearing hijab or niqab, I offer them immediately if they would like to work with one of my female coworkers first on a comfort level. But if not, I ask them what they'd like. Sometimes women in hijab are like, just like, here, check. And then other times they'll want to check on their own. There's all these ways that truly don't cost any money and take 1 second that impact the way that people navigate through healthcare. I'm not joking, for the rest of their life.
Yeah. And this is just so y'all can see. These are, I know I think I have like a shorter distance between my eye and my ear maybe than average, because I feel like I always end up with a whole bunch of like bent down parts, and these ones like they stick out so far down here. But this is y'all did these for me, and then they fit great.
Yay.
Yeah. And so you help people find these affirming glasses, and you like weave in these moments of like just honoring people as humans and honoring their autonomy, both like around, you know, transness, but also around like race and cultural stuff and around size stuff. Okay, put you on the hot spot. What are some like tips and tricks for like affirming glasses for gender diverse folks? Like what we were kind of just saying, like glasses don't have gender, but like I really feel like cat eye with sparkles like is gonna read really femme for people. Yeah. So like what are your like hot pointers?
Almost everything, I say this all day long. People usually, cis men will walk in and they'll ask, you know, are these, where's the men's section? You know, things like that. Or my favorite is not unisex. Unisex like disappears out of people's brain. I'm often asked for the, no joke, the non-binary glasses or the bisexual glasses. All day long. I would love to sell you bisexual glasses.
Can you actually make a bisexual glasses section at II? Can we do that this Pride Month? And like, y'all should do that and put it on TikTok or Instagram or whatever. That would be so fun and so funny.
It's just for bi people. No other part of LGBT. But in terms of tips, I would say that more chunk and more square or more rectangle will often appear more masculine. A lot of what I've learned, I joke, I've taken lessons in blending in, basically like voice lessons and fashion lessons, things like that. But what you learn when you're going more masked is that it's about doing less. So like when I talk, like if I want to blend in, I took voice lessons in case I'm in a situation I need to like not sound this way for safety. And it's about doing less with your tongue in your mouth. You're just like, hi, my name is Briar. How's it going? Like it's so think less is more if you want to mask it up. That's what I always try to tell people.
Yeah.
That being said, there's like 6'6" cis het men who walk in all day here and buy a really intense neon pink pair of glasses. It's totally chill. Like no one cares. But that's if you want to like be perceived by civilians as as like more masked, I would say do less. And then for more feminine things, there's a lot of shapes that read feminine, so that's cool. I always tell folks, if you do like putting on eye makeup, you want a little bit bigger of a window and a little thinner of a frame. If you don't like wearing eye makeup, but you want to still look feminine, make the glasses like your eye makeup, like you're talking about like sparkles or a cute pattern or something. Yeah. And it's generally read as them. But like I said, there's no rules.
Right. There's like we said, glasses don't have a gender, and like society has to assign meaning to these things. And it's not like there's not like 1,000 ways to be masked and 1,000 ways to be femme, right? Yeah. Like, you know, I always call myself a maximalist femme.
You are.
Right. And like there are so many people who are femme who like, you know, in lesbian culture, we would say like they're a chapstick lesbian, you know, like, right, who are like, you know, maybe gonna wear some tinted sunblock and some chapstick and some earth tones, you know, and like that's about it. Right. And so maybe they don't want the glitter, sparkle, neon pink glasses. That doesn't necessarily make them less fun. But I do think those are really great tips and tricks for people. What are like if you were gonna do tips and tricks for like face size, what do you have some? I would love to hear them.
People all day are obsessed with this idea that there is a correct shape for their face. Like there's a guide that they saw in Cosmo when they were 16, and it said that this was the shape of their face. And great, I will find you something in that shape. But truly what you want is when you put on those glasses, you want to look like yourself wearing a cool pair of glasses. If you suddenly, like I have a big oval of a head, if my head suddenly looks like a giant triangle, that's no good. That's skewing the shape of my face. And something like a skinny, too big rectangle will do that, where it kind of pulls the head out here. And then a lot of people just have a lot of ideas about who can and cannot wear a round frame for some reason. They'll be like, I can't wear that. And it's just no one has fit them. I have probably 1,000 round frames in the store right now.
Yeah.
And I have one that will fit you. I usually ask people when they come in, I'm always like, is there something you've never been able to find for yourself? Or a color you've always wanted to try out, or anything like that? But people to this day come in every single day and like, my head is like, I think my head is like a backwards rhombus. That's like a joke. But like, so not only that, people also will come in, are you ready? Having had a color study recently. They'll be like, these are my 3 colors. These are the only 3 colors I will buy from the store. And they will spend forever trying to exactly match that Pantone color. And this is a recent thing.
That's hilarious.
I'm gonna blame it on TikTok.
Maybe. So I feel like what I'm hearing about, like, for finding the right shape glasses based off of the size of your face or head, it's less about the glasses shape and more about finding the version of that shape that is like the right dimensions for your face.
Yeah.
Love it. So what Briar is saying is you can wear any shape glasses you want. You just need a specialist like him to help you find the version, the dimensions of that shape that rock out on your vibes. And then, as color matching, this is so fascinating. One of my dear, I'll call her my collegial sweetie. I coined a whole new word that really probably shouldn't be going onto this podcast, but it happens now. I navigate a lot of mixed relationships, but so I have a few, like, I'm poly, right? And so I have a lot of relationships, and I have a few sweeties, or like, people that I maybe do kissy datey things with sometimes, but that I also work in parallel to, right? So they work in the greater field of trans healthcare. We're not at the same organization or institution. Yeah. Sometimes we're not even in the same city, like, right? Because there's obviously, like, we need to worry about the power dynamics of things. And especially me as a physician in the greater field of healthcare, like, I'm often seen as the person with the most power, right? But anyways, so I coined a term because there's like I think I have 4 of them now. No, 5.
Collegial sweeties.
Yeah. So I had these people who we work in the same field, and we actually like met through work a lot of times.
Yeah.
And now we're sweeties too. So I call them my collegial sweeties.
I understood.
So now the internet knows more about me than they should. But so she's one of my collegial sweeties, and it's been such a joy and delight to get to know her and watch her evolution to some degree. She's about 10 years younger than me, and she said one of the sweetest things to me the other day, because I had sent her a text a few months ago about how, for a really long time, well, I quit dating cis men like over 10 years ago, and I recently started dating one again. And then I hadn't dated a cis woman in maybe about 5 years. And I was texting her and saying, yeah, it's been interesting to like be with cis people again. And like I was referencing her. And a few months later, she was like, so I don't think that's true. And I was like, I was like, tell me more. And she was like, I don't actually think I'm a cis woman. I just like, until I met you, I didn't really know that there like were options for someone who is like identified femme presenting and also like assigned female at birth that aren't cis women, right? Like that she was like, and like the more I met you and the more I've thought about my gender, like the thing that matters to me and my gender is like femness more than womanness, right? And so I thought like that was like so special and beautiful to me. But her, like someone in her past life told her, because she's like this cute strawberry blonde with green eyes, and fair skin, was like, you can only wear like these 3 colors, right? Like, you can't wear any of these other colors. And she's like, she's trying to undo some of that, like that happened to her at a young age right now, and exploring more colors and more things, and I think it's just been like really fun to watch some of her journey. But I think it's so, right, there's just like, there's so many options. Like you said, y'all have thousands of glasses and there's so many colors. And like, And it's like, when you think about pink, there's like 1,000 pinks, right? Like, and so I'm like, I would love to hear your tips on like picking colors for a skin tone and like what works like on less melanin and what works on more melanin. But I would also, I feel like part of what you're going to say is like, it's not the color, it's the shade or something like this. Like,
it's true.
Yeah,
that's true. Like I can wear on my face right now, I could put on a neon pink frame and it would look great. Yeah, if I put on like a blush pink frame, it's going to match my skin. Yeah. It's going to look real uncanny valley, creepy, too blendy in.
Yeah.
So what I tell folks is it should never make you look jaundiced. So you should never look yellow.
Yeah.
If you're really red, like I have really red undertones, like probably should make you look more red, you know, if that's something you want to avoid. But in terms of just like standard colors, your black, your tortoise, you know, like a brown kind of situation. Yeah. Almost every skin tone can wear all of those. So that's great. Yeah. And then I like a lot of more unique colors look much better against highly melanated skin.
Right.
So like the dark, if you come in and you have very dark skin, I'm going to have some amazing options for you. Basically, they're just like really unique colors that need the contrast to like pop off.
Right.
My favorite one that I'm waiting for the perfect face to come in for is like jade green.
Oh yeah, beautiful color.
It's going to look so good.
I feel this way about chartreuse. Like I want to wear a chartreuse every day.
Every day, but yeah.
And I'm like, I think it probably makes me look jaundiced, like what you're saying, right?
Yeah, I have a rule for this. I love every color on earth, and I really love really neon colors. You can wear it as a bottom instead of a top.
Yeah, I have like, it's so funny. I bought a dress the other day. You know, and just to like give the disclaimer for people, we were talking about a lot of things that again, like might play into like colonized American, like white supremacist, like beauty standards. Like there is like this component of like what colors are flattering. And some of that is tied to how we were socialized. And some of that is tied to like actually just what we individually find appealing. Mm-hmm. We are not here trying to solve the world's issues and things. We're just talking about glasses we like. So hopefully everyone can be with us in that space. And if we mismanage anything, we'd love to hear about it. And we're both open to getting feedback and learning. But back to colors and skin tones that we like. I just bought this like blush colored dress, which I historically am like, no white person should ever wear this color.
Do you look naked?
Kind of, right? Yeah, it's like very close to my skin tone. Okay, but the dress has a slit that is like almost all the way to the like meeting of my thighs. Like it is so high. The slit is so high. And so everyone who looks at the dress is not looking at the color or my face. Like they're just
looking at the slit.
Yeah, and everyone's like, this dress is amazing. Like you have to keep this dress. And I'm like, I have historically said this dress, this color is like a no, especially on this white person. But I've decided I'm going to keep it because 3 partners saw me in it and like lost their mind. And so you just have to,
confirmation.
You have to keep a piece of clothing like that. But it's like, okay, I'm definitely like I'm doing some more intense makeup when I wear that dress. Like I'm adding like a little more like highlight and low light than I would typically. So I'm going to add a little more color and contrast into my face. Right. And definitely like more like blush. And then I'm going to wear a really bold pink lipstick, not like that dusty color, but really not that dusty rose, but like really like a more like a magenta. And then I'm getting a necklace made that has like that magenta plus that dusty rose in it. And then pulls in some chartreuse and some gold. Yeah. And like, yeah, trying to like balance or offset the fact that like it's maybe not the best shade pink on me. But
can I interrupt you 1 second?
Yeah.
If you have not seen Crystal in public, you should know that Crystal never steps out of their house without a completely coordinated, impeccable outfit. I love seeing you walking around because people here dress so dull.
Seattle is it is true.
Look at me. I'm wearing my plaid shirt today and complaining about people who dress so.
And I am in like, this is funny. I'm in, I have to do some I'm like going to do some touch up painting after this. So it was like, I was like, okay, you need to look okay for the podcast, but also like, I don't want to like then take off those clothes and put on my painting clothes. So I was like, well, this red really pops, but this was my high school. I played basketball through ninth grade, like all as a little kid growing up through ninth grade. And then in 10th grade, I became a cheerleader. But so this was my high school basketball camp t-shirt, and it's like Lady Marauders. And the lady just made me like, and like
Lady Marauders.
It's just like so ironic compared to
so
my life now, right? But I thought I had to wear it. And it goes good with my red glasses that y'all made for me that I wanted to wear today.
That's
so, okay. What are other tips or tricks that like providers or people should know when they're thinking about glasses that really make them feel good about who they are? Is there anything else you want our listeners to take with them?
Yes. Gender affirming care is not just for trans people. All day long, I do gender affirming care for cis men and women who have, frankly, a lot of dysmorphia about their face.
Mm-hmm.
And they just, something in them is telling them that they are truly hideous and they can't see themselves. You know,
Yeah.
I know what that's like from this dysphoria, you know, but you cannot perceive yourself correctly. And then, for example, a man the other day, we put on something that made him look very dapper. And he had never seen himself like this in his entire life. And he was like, I don't know, this is really not what I usually wear. And I was like, is this something you want to wear? You know, not something you usually wear. And he was like, yeah. And he had to like build himself up to like just say yes to it. And that's important too.
Yeah.
Yes.
Yeah.
I don't take a Hippocratic oath or anything like that as an optician. But in my mind, when I enter into a medical field, I'm there to care for everybody. Even people that in my outside life, I'm like HATE, you know, like things like that. I'm going to take care of them.
Yeah.
You know, that's it. That's what I'm here for. And because I do that, I get to see how we're all interconnected and we all have the same insecurities. I mean, you know, it's really cool.
We're all human first.
Yeah. What?
We're all human first.
We're all humans first. Okay, I believe. That's it. Yeah. One thing that comes up over and over again, regardless of someone's gender identity, is their nose. That's a pretty common situation. And what I like to explain when somebody is feeling bad about their nose, I'm like, first off, yes, you could feel totally bad about how your body looks. That's your prerogative. Like, I'm not negging that, you know, like you get to feel your feelings about your nose. But I tell them, if you go to a museum right now that has marble busts, and this is usually a person, it's called an aquiline nose, where it sticks out and then goes out and down as the bump. You'll see that your nose was in fashion then. Every single one of those busts has your nose.
Yeah.
And I always say, as humans, we have made all of these rules up for ourselves and we have made ourselves miserable. We have gotten so intense about this that body parts, weight, shape, go in and out of fashion. They're just body parts. You don't get to pick things that you don't get a choice over should not be fashion. That's what I think. Yeah.
Yeah. I like absolutely agree. Gender affirming care is for everyone. And I feel like it's like, the cis people who are like on the like tirade against trans people kind of like shot themselves in the foot, because it's like, right, like every aesthetic intervention is gender affirming. And it's like, I'm like, instead of going against trans people, you should have supported trans people, because honestly, if you supported us, like the next step in this evolution is like all gender affirming surgeries are covered by insurance. So like the cis woman's like boob job or right, like that could have been where we were in 2025. Like if you had like thought it through. Okay.
I get a lot of targeted ads at this point all over the internet for cis men with low T. And they offer they're like, what is your beard a little thin? Like it's literally like it's like a commercial that makes the man feel really poor about himself. And then it's like, you need this tiny vial of testosterone. So yeah.
Absolutely. Well, Briar, I've had a delightful time talking to you. I feel like I talked to you for 7 more hours, but I do actually have a meeting coming up soon. So I unfortunately, very sadly, must let you go. Are there any parting words you would like to share with our listeners?
Yeah. I would like you to treat your eyes kindly.
Oh.
Yeah. My grandma Ann, she's alive, she's 95. And she says, you only get one set of feet, one set of teeth, and one set of eyes. And you should treat all three accordingly. That's what she taught me growing up. But yeah, if you feel like something is weird or it hurts or something like that, please go seek medical care. If you bought a weird pair of contacts off the internet and now your eyes look a little funny, please seek medical care. If you are having headaches every single day, maybe seek medical care. Like things like that, where it's like,
Yeah.
you only got the two of them and we can't replace them. So please, 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 like things like don't sleep in your contacts all the time. Things like that. Just really be kind to your eyes and you'll get to see for the rest of your life. That's great.
I love that. Thank you so much for joining us. I appreciate you immensely. It brings me so much joy knowing that 3 times a week you're helping someone find a new sense of joy in their face. Thank you.